For many decades, the treatment for patients in lower and middle income countries was the same as in other countries around the world. But ever since 2017, we have had great news and great advances in the treatment of diffuse large B-cell lymphoma with the incorporation of CAR T-cell therapy, bispecifics, and also there have been a wide range of international clinical trials going on. But ever since 2017, many countries around the world have changed their proportion of treatment for this group of patients, delivering an increasingly number of CAR T-cell therapies, and also now approved 2 different bispecifics for this group of patients with relapsed refractory diffuse large B-cell lymphoma. Well, accessing to these therapies is very difficult, with absolutely no access in Latin America, Africa, India, and many other countries, even countries around Europe. So there's a widening gap of opportunities of treatment for this group of patients, and this is reflected in a difference overall survival for patients that are treated in institutions and in countries that have access to CAR T-cell therapies or bispecifics versus other countries. Also, a big thing is that we don't have such a great amount of access to clinical trials, unfortunately. There are many well-prepared centers around different low and middle income countries that can do clinical trials, but still these global trials are not accessible to many of our countries. So we hope that in the future we can work as a community to prevent that this gap becomes more and more impressive, having less opportunities, and hopefully these new therapies can be delivered to a widening population of people around the world.